This little tube that we're looking through is the key to getting your dental implant placed in a modern way that increases the success, decreases the chair time, decreases the amount of pain that you have with your dental implant, and also can often decrease the amount of time it takes for it to heal so that you get your tooth faster. So what are we looking at? So we are looking at modern dentistry and the modern way to get your dental implant placed. So this right here is a 3D printed, digitally fabricated surgical guide. So let me go through this. Let me explain why it is that you'd want it done this way and why it is that we here at Las Cruces Dental Solutions don't do it the other way. So this is how we plan and place implants here at Las Cruces Dental Solutions in 2018. And so this isn't your grandpa's dentistry here. So as a practice, we love to connect with technologies that make things better for our patients, that decrease the treatment time, increase the success rates. If there's technologies that make things easier, make things more comfortable, we continually seek after these things, and this is a perfect example of it. So this is really cool. So let's go through this. So we actually take a three-dimensional scan of our patients. That gives us where we have all the information in 3D, in fact, including, you can see the trace of this nerve that as we're going to plan this case, we're going to be able to very easily protect our patients from nerve damage doing implants with modern 3D planning. And we can measure exactly where it's going, how it lines up inside, how far we are away from nerve structures, so that again we can do this very safely, which is really cool. Not only do we able to plan it and see it, but also we're able to create something that takes our plan and brings it right into the patient's mouth. So you'll see that with, let's go do this side. So this that just popped up is a 3D surgical guide that we created for a case. And what that's going to do, that's going to allow us to print that. And essentially, we're taking something that where old school dentists would take and just freehand that with some guessing and planning and get really some pretty good outcomes in that old environment, and we're able to up the ante, get even better outcomes with less pain to the patient, less surgery involved, know exactly what our distance is to the nerve, check in here. We know exactly whether we're safe or not, whether we're away from that nerve or not. And so what does that mean to you as the patient? That means that when we do the surgery, this is almost like laparoscopic implant placement. Instead of a dentist having to open things up nice and wide because of not seeing, they're able to just go through a small hole, very minimally invasive, have an easy time getting this done, quicker healing, less pain, higher success. There's a lot of reasons why I could go into why it increases the success. It just does. In dentistry, millimeters matter. And so it's really important for us to be guided accurately. What does that look like in the patient's mouth? Well, we take that guide that I originally showed you, and then we're able to take and just snap it into a case. And it drops down nice, lines up, and then we're able to take and basically do that, do the implant surgery straight through there, guiding us to the exact position that implant was planned for, saving time for you in the chair, makes that surgery very quick. It makes it a lot more painless, and increases your success rate. If I was getting an implant placed in 2018, I wouldn't have it done any other way.